The use of chemical warfare agents was undoubtedly horrible, but mustard gas was not only bad after all. Science is often serendipitous, and this cell-killing molecule actually fundamentally unlocked how we treat cancer. To understand how modern medicines and breakthroughs like antibody-drug conjugates work, we need to go back in time. We previously discussed how drug discovery was born in the 20th century and why the first drugs decomposed patients' butt cheeks or simply turned them blue. Feel free to check out that video first. There we learned that the Nobel Prize-winning German scientist Paul Ehrlich conceived the idea of magic bullets, meaning selective therapeutic agents that do not damage healthy tissues. He later discovered sulforsan, an arsenic-based drug, which turned out to have quite a cursed structure. But how did we go from treating syphilis with arsenic or treating malaria with a blue dye to chemotherapy against cancer? Well, only a few years after sulforsan's launch, humanity unleashed the horrors of chemical warfare in World War I. We'll talk about mustard gas and related compounds in more detail. In contrast to other agents in the armamentarium like phosgene and chlorine, mustard gas is actually not a gas and acts as an aerosol of very small drops. This sulfur-based molecule is not directly lethal either. Its primary objective was to absorb many already scarce medical resources of the enemy to treat the blisters and infections that it caused to its victims. If you're an OG follower of this channel, you might remember that mustard gas is somewhat connected to the discovery of cocaine. Let's briefly tune in to our video from 2 years ago. Time really flies. Coming home with a stash of coca leaves, he imported some of them into Germany, just in time for a nice PhD project for Niemann. Although cocaine-enriched extracts were obtained from coca leaves in 1855 already, Niemann was the first to truly isolate and characterize the primary alkaloid. He unsurprisingly gave it the name cocaine and published his research in 1860, earning him his well-deserved PhD. Niemann was a productive, top-notch researcher. In the same year, he described the synthesis of mustard gas from sulfur dichloride and ethylene. Unfortunately, this might have been a case similar to Marie Curie. Niemann correctly noted the toxic properties of this blister agent, which, as many of you know, saw its first military use during the First World War. Niemann died shortly after in 1861 due to a devastating lung infection, which very well might have been caused by his exposure to mustard gas. So, there you go. Not only were many of the classic chemists, particularly the German ones, involved in dubious research, but some of them might have perished due to their chemistry. The horrible impact on the skin and lungs were why mustard gas was used in World War I, but only in the aftermath did scientists uncover that it had other effects. In the bone marrow, it reduced the formation of white blood cells. This insight helped doctors better treat these cases, but also catalyzed more fundamental research into its mechanism of action. I assume that most viewers will know that white blood cells are part of the body's immune system and, plot twist, can also turn into cancer, known as lymphomas and leukemias. This post-war research initially aimed to develop antidotes to mustard gas. The two doctors Gilman and Goodman at Yale were involved in one of these research efforts in the early 1940s. Note that instead of sulfur mustard, they used nitrogen mustard. This was one of many analogues that were discovered in a quest to also find new chemical weapons that are even less volatile and easier to handle. The Chemical Warfare Service of the US Army kindly provided these agents to the Yale team for pharmacological evaluation. When making these videos, I often discover some gems in old publications, and this was the case here as well. You can pause the video or even better, read the personal full narrative account of Gilman on this story. They worked through hordes of rabbits and tried to identify antidotes to mustard gas by assessing the depletion of white blood cells. So following the observation that we mentioned earlier, at some point they had a major realization. If mustard gas kills normal white blood cells, would it also destroy abnormal ones? It just so happened that they had a spare mouse with a transplanted lymphoma, which is a tumor derived of lymphocyte white blood cells. Injection of the nitrogen mustard proved extremely effective, softening and shrinking the chunky tumor quite rapidly. Cancer is a shitty disease, so it eventually came back into full force after a few rounds of treatment, but ultimately this mouse survived far longer than expected. This prompted many other experiments that produced more encouraging results, and in 1942 led to the first therapeutic use of nitrogen mustard in a terminally ill lymphosarcoma patient. This poor guy was in the terminal stages without any options and received daily nitrogen mustard for 10 days, with a dose that, quote, turned out to be a most fortunate guess. Today you would slowly titrate up any investigational new drug, but they went all in directly. To their defense, there seemed to be a fairly wide margin between an effective dose and a lethal one. The account nicely captures that in the 1940s, there was a sense of therapeutic nihilism, with most physicians seeing the act of drug administration as an act of a charlatan. Because all the research was top secret, the nitrogen mustard was dubbed Compound X. So what happened? The nitrogen mustard had remarkable effects, essentially erasing the patient's tumor tissue, allowing him to eat and move without difficulty again. Due to this dramatic proof of concept, another patient was started on the regimen within a few days already. It wasn't all fine and dandy, as they also found that nitrogen mustard nuked the activity of the patient's blood marrow, reducing the production of normal blood cells needed in the body. To this day, this is one of the most common side effects of chemo or radiation therapy, but recovery can occur quite rapidly in most cases. The bigger issue was that just like in the animal studies, they also unfortunately encountered the issue of resistance. So the tumor recurred after 49 days, and after 3 months in total, the patient passed. Still, this method represented a total breakthrough. Particularly after 1946, when World War II secrecy restrictions were lifted, this and following reports inspired many other clinical trials and served as one of the foundations of cancer treatment. There was another important event that took place shortly after Gilman's and Goodman's advance. Let's rewind again for some context and history. You might know that the 1930s also brought nerve agents to the chemical warfare armamentarium, and these are much more lethal than mustard gas. One of the key figures was the German chemist Schrader, who after nearly knocking himself out with an early candidate, synthesized the first nerve agent called taboon. Schrader apparently found this one on December 23rd, so that was quite the Merry Christmas. The German army was really interested in it, and unsurprisingly, it resulted in the development of additional nerve agents like sarin. If there's one good thing about World War II, it was that chemical warfare agents were not used on the battlefield. The Germans did not know that they were the only ones with nerve agents, so they had a clear strategic advantage, but fortunately didn't use it. Still, everyone was loaded up on stockpiles and ready to retaliate should there be a first strike with chemical weapons. This leads us to our significant event in the Italian Bari harbor. During a surprise German air raid in late 1943, a secret cargo of dozens of tons of mustard gas got blown up and naturally afflicted many sailors. No one knew about the mustard gas, so no one bothered to quickly remove the sailors' contaminated clothes, and they ended up showing quite bad skin burns. People also reported smelling garlic during the attack, so they eventually called for a chemical warfare specialist, suspecting that the Germans might have used chemical weapons on them. Lieutenant Colonel Alexander rocked up, and while he was unaware of the mustard gas in Bari, this compound was no stranger to him. He was basically the perfect man for the job, as he apparently also experimented with mustard agents in his free time before the war. Those were definitely some poor rabbits and mice. Alexander investigated the scene in Bari very thoroughly. keeping death logs and trying to work out where these casualties were coming from. He recognized that the symptoms were more severe and deadly than usual with mustard gas. This is not surprising because the unaware sailors had spent hours in the contaminated seawater or in their wet clothes, prolonging their exposure. Alexander collected detailed medical records and tissue samples and ultimately reported the release of mustard gas in his chain of command. The British authorities wanted to keep things undercover to avoid triggering the use of chemical weapons by the Germans, and apparently this went up all the way to Churchill. I told you, you can really find fascinating things when digging through history. It took a year for the US to admit to the accident, but there was quite some covering up going on, with mustard gas deaths being counted as quote burns due to enemy action. Some online reporting claims that Alexander's work preceded the Yale clinical trial. That's not correct, but it makes still for an interesting story. To understand how mustard gas works, we can keep looking at old documents like this review published as an unclassified US Army report. Mustard gas attaches itself to electron-rich nucleophiles, thereby alkylating them. What makes it particularly electrophilic or reactive is a so-called neighboring group participation. The neighboring group refers to the central nitrogen or sulfur heteroatom, but by the way, there are also less known mustards based on oxygen. This means the molecule has two sides which are quite attracted to each other, a nucleophilic heteroatom and an electrophilic carbon chloride bond. So our active compound can be thought of a cyclic cation resulting from an intramolecular cyclization. This happens spontaneously in aqueous solution and occurs faster than any intermolecular reaction. If you replace the heteroatom with a boring carbon without an electron pair, the compound would be extremely unreactive in comparison. In our body, the key nucleophiles are amino acids in proteins and the DNA bases, importantly guanine. It has a particularly reactive nitrogen and oxygen, so either of these can be alkylated. Because there are two chlorides, mustard gas can eventually create crosslinks within or between DNA strands. The DNA is glued together, which sucks because it needs to separate for replication during cell growth or transcription to create proteins. If not repaired, these crosslinks ultimately stop the cell cycle and trigger apoptosis, aka programmed cell death. The bifunctional mechanism makes mustards much more cytotoxic than agents that have just one alkylation site. Cancer cells grow aggressively, so they are particularly affected by this blockade, but mustard gas also screws up any healthy cells it comes across. This is why mustard gas doesn't only shrink cancers, but with enough long-term exposure, it can actually cause them. Here's a report from a Japanese factory that had produced bonkers amounts of mustard gas with clearly less than optimal work safety standards. In that sample size of 500 workers, the occurrence of respiratory tract cancers was more than 30 times higher than what you'd expect otherwise. Protective equipment can minimize exposure, but is there another way of dealing with mustard gas? Well, you'll remember that we initially mentioned that the research of the 1930s and 40s was also intended to identify antidotes against blistering agents like mustard gas. Digging up our military report again, we see that the simple sodium thiosulfate proved to counteract our reactive culprit, the electrophilic sulfonium ion. Because thiosulfate has nucleophilic oxygen atoms, it can intercept the agent before it wreaks havoc. This really works in humans, but you need to lather yourself up with thiosulfate lotion or get quite a big infusion. It is not a true antidote in the sense that treatment after exposure is too late, because the sulfonium ions will have had enough alone time with your DNA. The body does have some mechanisms to repair DNA crosslinks, and as always with cellular biology, there are very complex pathways involved. However, this machinery is easily overwhelmed, and with sufficiently high exposure, the cell just bites the dust. In a previous video, we've reviewed a distinct cell repair mechanism and how it can influence survival chances in the brain cancer glioblastoma. So if this is interesting to you, you might want to check that one out. The underappreciated fact is that many of the chemotherapies which we still use today use the same cross-linking logic, including the stranger platinum-based agents like cisplatin. So they have the same effect, but also the same issue. Because cell damage is not really specific to the cancer tissues, the dose-limiting factor for these chemotherapies is toxicity in the blood and nervous system. But how did we go from sulfur mustard to all these different molecules, and how the heck did we come up with giving platinum salts to humans? The first successful mustard analog was Chlorambucil. We need to realize that on the spectrum of reactivity, sulfur mustard is more potent than nitrogen due to its higher nucleophilicity, so it forms the reactive cation very quickly. The idea behind Chlorambucil was to further decrease the nitrogen's reactivity, extending the drug's half-life and allowing for more efficient distribution in the body. This compound was approved in 1957 and is still being used today. If we can reduce reactivity in general, we might also ask if we can make mustards more selective for cancer cells, so that they do not go haywire in our blood and nervous system. Introducing Melphalan, essentially an amino acid variant of Chlorambucil. The idea was that a compound that looks like a protein building block might see higher uptake in tumors given that they grow faster. Indeed, the compound is shuttled into cells through amino acid transporters, so you could call this the first successful step towards a more targeted or selective chemotherapy. Melphalan was initially used in lower doses, but in the 80s, clinical results showed that much higher doses can kill cancers more exhaustively and overcome emergent resistance. Obviously, this comes at a cost of a higher systemic toxicity, so patients would need to be young and fit enough for the regimen. Still today, Melphalan is one of the most effective drugs that we have in myeloma. One interesting way to minimize toxicity is a Melphalan liver delivery system, just recently approved in 2023. The target are liver metastases caused by uveal melanoma, a rare type of eye cancer. The prognosis for these patients is dismal, with a median overall survival of approximately 1 year. The approach temporarily isolates the liver's blood supply and then exposes it to high doses of Melphalan, basically a chemosaturation of the liver. Before returning the blood to the body, it is filtered to remove most of the chemotherapy again. The setup looks strange, and my dearest condolences to anyone who needs to go through procedures like this, but it is actually less invasive than surgery, allows for retreatment, and has shown to be one of the only ways of getting a response in these patients. Rewinding time again, the exploration of improved mustards was not limited to just Melphalan. At the same time, in the 50s, scientists also investigated the prodrug cyclophosphamide. Just like Chlorambucil and Melphalan, the delocalization of the nitrogen's electron pair reduces its reactivity compared to nitrogen or sulfur mustard. The hypothesis was that this drug would selectively target cancers that have a high level of enzymes that might hydrolyze the prodrug and release the active substance. This assumption proved to be wrong because the primary metabolism is not hydrolysis, but rather oxidation in the liver. Through several reactions, the prodrug is converted to a phosphoramide with a negatively charged oxygen next to the phosphorus. This eliminates the electron withdrawing effect of the moiety, reducing the delocalization of the nitrogen's electrons. All of this simply reactivates the nitrogen towards neighboring group participation to kick out the chloride and generate the reactive ion that causes the DNA damage. The metabolic hypothesis was not only wrong, but the entire situation proved to be much more complex as always. You see, after the initial critical oxidation, the metabolic intermediates can escape the liver and circulate in the bloodstream. So, selectivity would only be provided if the active molecule were retained in the cells where it had been formed. The story is even more nuanced. You see on the top that there's a competing process catalyzed by aldehyde dehydrogenase enzymes. This pathway prevents drug activation because the free carboxylic acid does not undergo beta elimination like the aldehyde. So the side chain is not cleaved and the nitrogen's nucleophilicity remains suppressed. This means that tissues with high levels of deactivating enzymes experience a lower toxicity from cyclophosphamide, and indeed there's been a bunch of studies into these effects. Overall, this is yet another mustard-like drug that we use still today, either to treat cancers or to prepare stem cell transplants by essentially wiping out the patient's blood marrow. Our final mustard variant for today is Carmustine. Now it's time for you to use what you've learned. What do you think? How does this compound act? Similar to cyclophosphamide, it is deactivated by the electron withdrawing urea group. So clearly there needs to be some form of activation and release from this group. Under aqueous conditions, the nitrosourea exists in an equilibrium with its tautomer and its hydrated form. From this species, we can break the weakened CN bond to release a carbamate and, more importantly, a diazine. By now, you're probably correctly thinking of diazo chemistry because elimination can create a highly reactive diazonium ion. This is our actual electrophile, and just like the mustards, it is a bifunctional alkylating agent. In the next figure showing the DNA damage, the alkylation is drawn at the oxygen of guanine. Remember we mentioned that both the nitrogen and the oxygen are nucleophilic sites. A cute touch is the insight that we can have even another example of neighboring group participation between the first and second alkylation. The end result is the same as for all other compounds we discussed, DNA crosslinks which lead to cell death. Carmustine does not only have a more advanced chemistry mechanism, it also has an interesting route of administration, the implantation of biodegradable discs after surgical removal of brain tumors. These discs are designed to slowly release carmustine over 3 weeks directly into the post-op cavity. The exposure to chemotherapy is highest within a few millimeters of the implant, so there is much lower unspecific toxicity in the brain and broader body. From our previous video on glioblastoma, you know that brain cancer is particularly terrible, so any therapeutic benefits are greatly appreciated. Before wrapping up, I did want to mention that platinum complexes work similarly to mustards, though the nature of their cross-linking is not an alkylation but rather a complexation. The discovery and use of platinum chemotherapies warrant a dedicated video in my view, so I will leave this as a teaser. I also want to build on the knowledge we've gained to eventually talk about antibody-drug conjugates, which are basically a modern way of targeted chemotherapy. There's a lot of interesting history, chemistry, biology and clinical results to cover here, so comment below if you're interested in more videos on cancer therapies. Thanks a lot for watching until the end. This video was less organic chemistry focused, but I hope the history and different examples were insightful. Thanks as always to my channel supporters. Let me know how you liked it and I hope to see you soon in the next one. Until then, all the best.